Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider. Welcome back, everybody, to another episode of Explain This. I'm with the star of the show in person today in West Knoxville, Robin Riddle. How are you?
I'm doing great. How are you?
I am wonderful. This topic today is fascinating to me. We've had a video on endometriosis.
Yeah.
But I didn't know the relationship between that and migraines. So what's going on here?
So there is there's a newer article out that's looking at the use of migraine medications with treatment of pain and then progression of endometriosis. So I wanted to talk about it a little bit today.
Let's talk about it.
Okay. So we've already done a video, like you said, on endometriosis. Reference back to that if you have really specific questions about endo. But endometriosis is basically just a condition that involves painful inflammatory lesions of endometrial tissue located outside of the uterus. Affects about 10% of women worldwide. So it's a pretty prevalent thing.
Yeah.
I really think it's probably underdiagnosed, truly, because the only way to conclusively diagnose endometriosis is with a laparoscopic surgery. So, unless women are struggling with a lot of pain or infertility, they're usually not going to be like, hey, sign me up. I want to know if I have this. Like, let's go digging around and looking. So I do think that the actual number of women with this is probably a lot higher than what we think.
Yeah.
So currently, treatment for endometriosis really just revolves around hormonal therapies. So using things like birth control to suppress the hormones that feed that endometriosis. Pain relievers or anti-inflammatories, and then surgery to remove the lesions.
Okay.
So there's not a whole lot of options.
Not a lot of options.
But about 1/3 of women don't get adequate pain control with these interventions. So even though, they're given pain meds or they're on, ibuprofen every single day, they're still having pain with this.
Is it like headache pain or just pain all around?
Endometriosis is very closely linked with migraines, which we'll talk about, but also abdominal pain. Like it's a lot of bloating, a lot of abdominal pain, discomfort. And so we're not getting adequate relief with the pain medicines. I mean, I've had women come in that are on birth control to suppress the hormones that are feeding this and on chronic, like 800 milligrams of ibuprofen 3 times a day, both of which are terrible for you and awful for your gut. And they're still in chronic pain every single day. So this new study came out that's looking at repurposing medicines that are already FDA approved for migraines and using them for the treatment of this endometriosis pain.
Okay.
Just super interesting. So the study first looked at mice, of course, to investigate the pain signaling pathways for endometriosis. And then they focused in on the pathway that they feel like is most responsible, which is the calcitonin gene-related peptide pathway. So it's CGRP for short, and they confirmed that those nerve fibers are responsible for pain of endometriosis, and those nerve fibers are also present in human endometriosis lesions.
Interesting.
So they looked at it in mice first, because of course that's what we do, but then confirmed that in humans, those are the same pain pathways that we're dealing with when we're looking at endometriosis.
So basically what I'm hearing is medication for the migraine also works for endometriosis.
It can.
Got it. Okay.
So these CGRP is a neuropeptide that's released by the pain-sensing nerve fibers. And those are recognized to have a key role in migraines, but also a key role in endometriosis pain. So in this study, they ablated or burned those CGRP-containing nerve fibers in the mice, and they saw a decrease in pain. Of course, in humans, ablating those nerves is not going to be a great option, but we do have medications that block those nerve pathways. And in doing that ablation, of course, they saw a decrease in pain, but they also saw that the endometrial lesions decreased by about 1/3, in size. So whenever they took away the nerve pathway that was feeding the pain to the endometrial lesions, it also decreased those lesions in size.
Interesting.
So there's the potential to delay the progression of the disease with these medications.
I was about to ask you, How big of a deal is that?
That's a really big deal.
Okay.
So endometriosis is a chronic inflammatory condition
And
that's always growing. Yes.
Okay.
Yes. So, even whenever you have surgery for endometriosis and you go in and take those lesions out, they will start to regrow at some point.
Okay.
It's got an autoimmune component to it. Like there's things that we can do to slow it down. But we don't have a ton of great options for slowing it down. So this is a new potential option for this.
That is super interesting.
Yeah, so they tested 4 different medicines. 2 of them are antibody-based medicines that target the CGRP receptors. So those medications, brand name are Ajovy and Emgality. And so these are injectable medications that are currently taken for migraines. And then they also tested 2 receptor agonists, so Nurtec and Ubrelvy, which are both oral medications. And the study did find that the medications yielded benefits similar to the nerve ablation. So it was able to stop the pain sensing because it's blocking the receptors for that CGRP. And it was also able to decrease the size of the endometrial lesions.
Interesting.
Yeah. So, like I said, those same nerve fibers present in endometrial lesions associated with pain, associated with growth. So these medications do show potential for being able to stop both of those.
So it's addressing the migraine that could come from the endometriosis, but also slowing down the growth of the endometrial linings?
The lesions.
Lesions.
And addressing the pain of the endometrial lesions.
And that's another big factor.
Okay. Again, with endometriosis, migraines are a very common thing that we're seeing with endo. So yes, we are preventing the migraines, but we're also preventing the abdominal pain, and we're slowing the growth of the lesions.
Super interesting.
So this is kind of newer in the research. We're still in the beginning phases, but the nice thing is that these are already FDA-approved medications, and we already know the side effect profile for these medications. So, in a practice like ours where we use things off-label all the time, if I have a patient coming in with complaints of endometriosis, this is probably going to be one of the things that I'm going to try.
Yeah.
There's a lot of natural things that we do. Again, we've got a video that talks about that. But Nurtec, one of the medications specifically, we use Nurtec all the time. That's like my top migraine medication that I recommend for people.
Yeah.
I love it. It's got a very clean side effect profile. People do really well on it. So now knowing that there's this potential that it's also going to have a great impact for endometriosis makes me love it even more.
That's so exciting.
Yeah.
Like, that's super cool.
Yeah, absolutely.
I love that. Guys, if you have questions, put them in the comments. This is kind of like relatively, what do you call it when it's like topical? Like
it's a new topic out
thing.
there. It's a new kind of trending thing right now. That
are you trying it yet, or is this so new that you're still in your...
I have incidentally tried it.
Okay.
Because again, a lot of endometriosis patients have migraines. So I've given a lot of them Nurtec, not knowing everything that I was doing.
Yeah.
So now I can purposely be like, hey, like there is the potential that this will have a really positive benefit for the endometriosis side of things too.
So cool.
Yeah.
Guys, you name it, we explain it. Robin, thank you so much for explaining this to us today.
Absolutely.
We'll see you guys next time. We'll see y'all next time.
Don't go away.